This is Boomer Life on CL 650.
Welcome back to the program. Dr. Fadi Tarazi is an orthopedic surgeon at False Creek Healthcare Center with us on Boomer Life today. And on this particular portion of the program, we're going to talk about the famous lower body injuries that we hear so often in the sportscasts. They don't tell us about knees and hips and ankles anymore, Doc. Everybody has just got a lower or upper body injury. Now, you were very helpful in identifying the fact that the most common, the most likely or prevalent surgical procedure is knees that you do at False Creek Healthcare Center. Yes. But there's also, on the lower body, we're talking hips, knees, and ankles. Knees can be replaced. Hips, we certainly know, can be replaced. How about ankles? Is there such a thing as an ankle replacement?
Yep, it does exist. We do. Some surgeons do ankle replacement. It's basically putting plastic and metal between the foot and the shin bone.
Okay.
And that will act as the articulation.
Now, you mentioned shins, and we were talking about running just before the break. And runners do present with a unique set of symptoms and problems of their own, don't they? Because of the stress that they create with that repetitive athletic activity day in, day out, usually on hard concrete surfaces. And eventually, what sort of damage is typical of a runner in an urban environment?
In an urban environment, exactly because the surfaces are so hard.
Running on concrete and asphalt,
The impact forces get transmitted through the joints of the lower extremity.
Exactly.
And through the knee joint, because the knee is not a very, we call it congruous joint, meaning the bones are very shallow, and that's what produces the most shearing forces in the knee joint.
Okay.
And those shearing forces are more likely to produce arthritis than in a joint which is more congruous, which has more bony conformity, and such as the hip joint.
Okay.
That's why a knee arthritis is more common than hip arthritis with running.
Okay, and we hear of a malady called shin splints. What's that?
Shin splints is thought to be a microfracture, little tiny cracks in the bone in the middle of the shin bone.
So this is below the knee now?
Below the knee, halfway between the knee and the ankle,
okay,
and the front of the leg. And you get little microfractures from the impact of running when you land on the ground.
Right.
When your foot lands with every step. And the pain will resolve once you eliminate the activity. And you have to wait 6 or 8 weeks without running, and then the shin splints will resolve.
Is there anything you as a runner can do to modify your style, perhaps, to reduce the possibility of shin splints, or is it just comes with the territory?
You can do a lot of things. You can change your footwear to something that's more cushioned. You can convert to running on a softer surface,
right,
such as a grass field or even artificial turf. Those surfaces will cushion and minimize the stress that is transmitted across the bones.
Okay. So in terms of knees, though, and we've touched on a couple of things that happens with knees, but when do you, the orthopedic surgeon, have to tell the patient, you're going to need a transplant here. There's nothing else I can do. It's just too shot. It's got to be replaced. What are you looking for before you make that call?
We look at the patient's function. If the pain is affecting their ability to even plain walking 2-3 blocks and they can't walk anymore.
Right.
They're using a cane continuously. They're having to take painkillers continuously. And their day-to-day life is very much affected. That's the time. And they have a lot of arthritis on the x-rays. Then that's the time to consider a joint replacement surgery.
And typically what sort of time frame is attached to a knee replacement, since it's the most common one? How long does it take for a patient to go through that process?
The surgical procedure?
Yeah.
The surgery is anywhere from about 90 minutes to 2 hours.
Okay.
And the patient is in hospital for about 3 to 5 days afterwards. They usually walk with a walker at the beginning until their knee gets more mobile. They have to attend physiotherapy upon discharge. And their overall recovery is about 3 to 6 months.
Right. And is it the same with either ankles or hips, or do they present even more difficult recovery times?
No, recoveries are very similar.
Okay.
After surgery.
So what's the difference, or is the technique then, or the call you just described the circumstances under which you would recommend a replacement of a knee. Would you be looking for similar symptoms and mobility capabilities for either the hips or the ankles as well?
Yes. Yeah.
Okay.
We look at pain and functional limitations.
Right. I guess it's when you get to be a boomer, you get to have a little bit of time because you've got a little bit of living under your belt. And you take a look at what might be the rest of your life, and then you want to establish a sort of a minimum baseline, to use your word, for a quality of life. You want to enjoy the rest of your days at a certain level of quality. And so if your old body's just too shot, or if it's so shot that you end up on prescription medication, serious painkillers, as part of your daily routine every day, that's not much of a quality of life, is it?
No, because eventually your body will also get used to those painkillers.
Exactly.
So you're going to need more and more moving forward. And where does that stop?
Right. And we're certainly becoming more and more aware of the addictive qualities of some painkillers and the problems that they present as a whole new thing, isn't it?
Absolutely. So at one point we have to pull the trigger and say, this joint has had enough.
Okay.
And it does need to be replaced so that we can take the person off of the painkillers and restore the function and the lifestyle that the patient would like and deserves.
Right, exactly. Now, when it comes to ankles, would you, the orthopedic surgeon, do that? Or because there's a foot involved, would you get the foot guys involved on the ankle replacement?
With the ankle replacement, it's quite a specialized procedure, and generally it is the orthopedic surgeons specialized in foot and ankle surgery that do it.
I see. Okay. So not necessarily a podiatrist, but an orthopedic with podiatry specialty.
Yeah, podiatrists generally look after bunions. They look after different foot pain.
Okay.
But when it comes to ankle replacement surgery, it is generally an orthopedic surgeon that does that because it has to be done in a hospital setting.
Right.
And podiatrists work more in a
clinical environment?
Correct.
Ah, okay. So back to the whole matter of replacement is it's not a fashionable thing. It still isn't. Well, you're not anybody really until you've had a replacement. Society hasn't evolved to that. But aren't we lucky that we've got to a point where serious chronic pain can be eliminated?
Yes.
That's remarkable.
At least we have that ability.
Now, in the 15 years that you've been an orthopedic surgeon, talk to us about the replacement technology and how it's improved in your time.
The way we do joint replacement has improved. It has the prostheses have changed in designs. They last longer, and when it used to be 5 to 10 years lifespan of a prosthesis where it has to be redone. Now we're looking at 15 to 20 years before they have to be redone.
Right.
So it has made a huge difference in terms of longevity of the joint after a knee replacement.
Oh.
And because of that, now we can afford doing it on an earlier or a younger patient.
Right.
Because we know it's going to last longer.
Right. And you mentioned that it's not common, but arthritis does occur occasionally in younger people. And do some of those people stricken with arthritis in their younger years, do they end up getting replacements?
Yeah, sometimes we see people in their 40s or 50s having knee replacements. We try to delay it as much as possible, but generally those individuals, they want to have some pain-free years now.
Of course.
They often say, I don't care what I'm 80 or 90 years old, I want to live now.
A quick little story for you. My wife had a hip replacement about 6 years ago, and it's a titanium apparatus. So she, when we go to airports, she looks at the security guy, goes, "I'm bionic. I've had a hip replacement," before you go through that thing, and of course she beeps. Are the materials now in use in replacement still going to beep at airports, or have they moved on to different substances?
In the joint replacement, we still have to use metal because you want something strong.
Okay.
It cannot be plastic only.
All right.
It has to be metal. And sometimes it's combined with plastic, but there has to be a big portion of it is metal. So it will continue to beep. And we don't have a choice with that.
You know, so if that's what it's come down to, a little beeping and an extra swipe with the security wand at the airport security zone, if that's the only inconvenience that is presented by a joint replacement, it's certainly something a person can live with pretty easily.
It's tolerable.
All right, now we're going to call upon, I'm going to take a quick break here, and we're going to, again, we're talking with Dr. Fadi Tarazi from False Creek Healthcare Center. We mentioned earlier, Dr. Tarazi was once upon a time ago the team doctor for the Vancouver Canadians baseball team and the Vancouver Ravens lacrosse team. Well, one of the most famous surgical procedures in all of sports is something baseball pitchers get. It's called Tommy John surgery, and the doc's going to tell us what it is and how it gets done when we continue on Boomer Life on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.